Hello, friends. Welcome to our YouTube channel SLP Sanjay Kumar Voice Therapist. And today we are live, and today we are before treatment live with us. Peter is here. Peter stays in UK, and he's having a kind of voice problem. So in this live, you'll be listening Peter's voice before treatment, and today date is 18th of May 2024. And in the future, we'll be doing post-treatment live. And of course, because he stays in UK and I'm staying in Bangalore, India, so we'll be giving all the session by online method. And if you have a curiosity to know what changes happen after the treatment, please subscribe our YouTube channel, press the bell icon so that you can watch the post-treatment video of Peter. And so, Peter, can you unmute your mic and tell us what exactly problem you're facing?
Hi, I'm Peter. I live in the UK. I'm originally from Ghana. I have a high-pitched voice that it's not normal for an adult male of my age. So I've watched videos of doctor on YouTube. So I just had faith that if I get to him and with the voice therapy that he offers, I'll be able to have a normal voice as every adult male. Yeah.
So, how this present voice is affecting your career?
Yeah. Yes.
How this high pitched voice is affecting your day to day life, communication, your career?
Yeah, because it's kind of an abnormal like situation, and people tend to question why you have that kind of voice. So it makes meeting new people very challenging. So it kind of make you shy in speaking in public or speaking to new people. Yeah.
Okay, so in this live, I'll be just discussing few things just to create awareness. I'll be introducing about myself, and yeah, I'll be telling about myself. There will be a small introduction about myself, our YouTube channel, what kind of services we provide, and 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 how to keep your voice healthy. So few things I'm going to share. Maybe it will be useful for everyone, and so just those who are watching this live, please connect it with us and let's go one by one. So my name is Sanjay Kumar. By profession, I'm speech language pathologist and audiologist. My area of interest is treating voice disorder. I have a study from AIMS Delhi. AIMS Delhi, full form is All Institute of Medical Science, New Delhi, and I did my Bachelor of Science honors in speech and hearing from AIMS New Delhi. And I did my Master of Science in Speech Language Pathology from University of Mysore. I think those who are new, I will be showing my degrees just for awareness, because I am very much create awareness about the quack practice in India. There are certain healthcare quacks, and they will also project themselves like they are a speech language pathologist and audiologist. So sometime think it's my responsibility to create awareness so that people can understand the difference between the healthcare quacks and the normal people. So I'll be showing my degree also. So those who are I don't, this is the left side. This is my bachelor degree from AIMS New Delhi, and this is my master degree. So when you are going to take a voice therapy or speech therapy, especially in India, so always check the credential of the person from whom you are going to take the treatment. So yeah. So let's go one by one. So I started my YouTube channel in the year 2010 to create hope across the globe among the people having communication disorder, and create awareness about the non-surgical management of the voice disorder. So we upload before treatment and after treatment videos, success stories at our YouTube channel, and this create hope. So, and our client list include people across the globe. And our center name is Sanjay Speech Hearing and Rehabilitation Center, that is located in Bangalore, India. And that center also we started in the year 2010. So those who want to do some research about our center, where it's located, even you do the Google search also, after writing Sanjay Speech Hearing and Rehabilitation Center, Bangalore. You can easily find out. And whenever you are going to start the speech therapy or voice therapy, now always check the credentials of the speech language pathologist and speech therapist, because in the social media is sometime healthcare quacks will write with their name like speech therapist, speech language pathologist, voice therapist, and innocent people will not able to differentiate. So just try to find out from which college or which speech and hearing college, which medical college he has studied, what is the name of the degree, and what is the full form of that degree, and if he has registered in the Rehabilitation Council of India or not. If he has registered, what is the RCICRR number? So check, and if he has RCICRR number, so is that RCICRR number is like to work as a speech language pathologist and audiologist or not? Because some other healthcare professional, those who work in the rehabilitation, like speech and hearing technician, ear mold technician, special educator, psychologist, they also will be having the RCICRR number. But they, if it is a psychologist, if he's a psychologist or she is a psychologist, so she will be registered as a psychologist. Same way, if he or she is a audiologist or a speech language pathologist, so he will be registered as a speech pathologist and audiologist. So always check with the Rehabilitation Council of India's website. And those who are having curiosity, what could be the my RCICRR number? So please refer the description of this video. So this is just for the awareness and the kind of services we provide to understand. I will request those who are new to our YouTube channel, just refer our YouTube channel. So this is our YouTube channel, and our YouTube channel name is SLP Sanjay Kumar Voice Therapist, and if you'll explore our YouTube channel playlist, you'll find different kind of playlist with the different communication disorder, and it will be having pre and post treatment videos. So that will help you to know that how much time it took to get treated to get particular result. It will be also showing how much was the duration and what kind of services you provide. So you'll get in more detail. So that is my request to please refer that. And for those who are new at our YouTube channel, and I was telling, like, I'll be talking about how to keep your voice healthy. So that is for everyone what I'm going to tell. If you're having the voice problem and if you're not having the voice problem, this is going to help. Drink plenty of water. Water is a very good lubricant. If you drink plenty of water, it is going to keep your voice and vocal cord more healthier. And 10 to 12 glass of drinking water at room temperature is a very good idea. Avoid frequent throat clearing. If you do frequently, like very frequently, there will be a lot of friction between the vocal cords, and that may damage your voice and vocal cords. Avoid whispering. If you are telling, like, my name is Sanjay Kumar, how are you? Something, if you are telling that, so it create more stress on the vocal cords. Avoid whispering. And if there is a background noise and you need to speak, to avoid to speak unless it is not very necessary. If it is very necessary, then only you can speak, because during the background noise you need to raise your voice, and that will create unnecessarily stress on your vocal cord. So avoid speaking when the background noise is very high. And if you have any voice problem for more than 2 weeks, to meet a certified professional like speech pathologist, or if an otolaryngologist, ENT doctor. And walking, jogging, doing some yoga, some physical exercise will create a better stamina. So you'll be able to give sufficient air pressure below the vocal cords. So you'll be having better voice quality. And now I'll be talking more about, like, Peter, you are having a high pitch voice. So why the high pitch voice happen? What are the symptoms of the high pitch voice? What we do in the voice therapy? Okay, so high pitch voice symptom is very easy to understand. Like if you are a boy whose age is more than 14 for 15 years, and when you are talking on the phone, other side of communication partner is thinking they are talking to a female, or he or she is thinking that I'm talking to a small child, but he's not a small child. He's a boy more than for 15 years, 16 years, or even 14 years more, means more than 14 years old boy. And in that situation, it can be a symptom of a high-pitched voice, because nowadays people are using phones, so it's very easy to understand. And mostly what happened during the pubertal age, if a particular boy who's still high-pitched having the voice, and the others friends are having low pitch voice, so they will start making fun of him. That will affect his confidence level. So we should take this seriously. Those who are parents and they are watching, it's create the low confidence as well among kids sometime. So this is the high pitch voice symptom. Like it will look like a small child or girl. Even the patient ages, for example, 55 years or 60 years, and when he's on the phone call, they are thinking they are talking to a small child or a girl or woman. So this can be a symptom of a high pitched voice. So why it happens? To understand why it happened, let's understand the normal speech production mechanism. Once we understand the normal speech production mechanism, it will be easier for us to understand the abnormal. For normal speech production, first thing is the thoughts that comes in the brain. Then we take air, that air goes to the lungs. When we breathe out, we put air pressure below the vocal cords. Once you put air pressure below the vocal cords start moving like a string of a violin and guitar, and sounds generate. Then we modify that sound into different sound with the help of our articulators like lips, tongue, jaw, teeth, palate. These are known as articulators. So when we say a one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cord moves, sounds generate, we modify that sound into different sound. In one sentence there are so many words, in each word there are so many sound, each sound has own place, own manner of articulations. It is a little complex process. In this process there are hundreds of our body muscles works in a very, very coordinated way. So as I told, here we have larynx. Inside the larynx we have two string like structures known as vocal cord. So before puberty, either it's a boy or it's a girl, there will be no much difference between the vocal cords of the boys or a girl before puberty. But in case of boys, what happens? The vocal cord mass length increases due to a hormone called testosterone. In case of boys, so when the vocal cord mass and length increases, pitch reduces. Let's understand in more simpler form. Before puberty, there will be no much difference between the vocal cords of a boy or a girl. But in case of boys, means if we consider a guitar, like before puberty, either it's a boy or a girl, the vocal cords are like a thin string of a guitar, like a structure. But during puberty, in case of boys, due to a hormone called testosterone, mass of the vocal cord, length of the vocal cord increases and it becomes thick string of a guitar like a structure. So the pitch become lower. But the guy who are having a such kind of pitch problem, from childhood to puberty, he spoke in a high pitched voice like you. And during puberty, vocal cord mass got changed, length got changed. It is ready to produce the low pitched voice. But because of so many years habit, people like you will not able to switch on to the new low pitched voice. Reason may be the psychological, but later it convert into the biophysical as well. So what we'll start doing, suppose this is the after the testosterone impact, this is the mass and the length of the vocal cord. So that boy who is having the high pitched voice, instead of vibrating whole mass and the whole length of the vocal cord, it will start vibrating thin edges of the vocal cord. So once you start vibrating thin edges of the vocal cord, so vocal cord is actually a thick string of a guitar like a structure, but behaving like a thin string of a guitar like a structure. So when the guitar string will be the thin, pitch will be higher. So what we do as a speech language pathologist, we don't replace the larynx or we don't replace the vocal cord. What we do, what the vocal cords you are having, suppose you are just vibrating thin edges of the vocal cord, will stimulate whole mass and the whole length of the vocal cord. So the vocal cord, which was earlier behaving a thin string of a guitar like a structure, will start behaving like a thick string of a guitar like a structure, and the voice will become from feminine to masculine. So this is the biophysics of the problem, the kind of problem you are having. So high pitch voice is a kind of symptom, but high pitch, I'm talking about the normal vocal cord condition, what you are having, based on my perceptual evolution and other evolution. But sometime the problem called phonatory gap, sulcus vocalis, muscle tension dysphonia may result into the high pitched voice. And so all high pitched voice are not exactly the same. Depending upon the problem, we do the treatment. And earlier I was thinking, just before 6 months, if you think, I was just thinking that sulcus vocalis is a congenital condition. Like sulcus vocalis will be from by birth if some patient is having. So what happened? There was a one patient 3 years back. He communicated it with us, and we sent a mail, and the kind of problem he was having, like you, I was very confident we can correct it, and we sent mail accordingly. And then after 3 years, he again communicated with us, and then the kind of voice he was having, then he spoke to us on the phone. I was not very confident, like the kind of voice he's having, I'll be able to help him. And so we suggested him to go for the laryngoscopy, and we found that he was having the sulcus vocalis. So I started doing research. If the patient is not taking treatment or delaying treatment or taking treatment by wrong method, self-treatment, taking from the healthcare quacks, it's called as vocal abuse. If you're doing wrong treatment, wrong vocal exercise, so can vocal abuse result into the sulcus vocalis or phonatory gap? So I found some research article. Even you can do the googling also. In the Google, you can do some research. Okay, sulcus vocalis may result, means vocal abuse may result into the sulcus vocalis. And I was surprised. I found some articles. So friends, my request from for you is, if you are having a pitch problem, especially if you are in a pubertal age or even more also, and don't do the self treatment, don't take treatment from the healthcare quacks, take help from the certified professionals only. Because once the sulcus vocalis develop, if you explore my YouTube channel playlist, there is a playlist of sulcus vocalis also. There you will find the changes are not very impressive. So once the phonatory gap, sulcus vocalis develop, so even if you're coming to my center, may or may not, I'll be able to help you. That kind of a statement I'm going to use. So this is the message for the people who are having the high pitch voice. And yes, so this is just for creating awareness. And I have seen that sometime people from US, from UK also come to my center, not by online, physically also. So do you think that in USA there are no speech language pathologists? Of course, before coming, they must have tried, and even other country also from people come to our center. So they must have tried, and here they got improved, and they didn't improve. So I am a something Superman? No, answer is no. Because speech language pathology is a very broad field. There are some speech language pathologists, they will be expert in dysphagia, a kind of problem called swallowing problem, swallowing disorder. There are some speech pathologists, they will be expert in treating in delayed speech and language, depending upon their area of interest. They will start working, they will be more expert. There are certain speech language pathologists, they will be more expert in neurogenic communication disorder, like aphasia, which happen after the stroke. And people like me are expert in treating voice disorder. So the guy who came to our center, when he consulted in his own country, a speech pathologist, he may be expert in treating some other communication disorder, and he went for the treatment of voice disorder, so that he was not able to get much help. And when he came to our center, he improved. And so whenever we are taking help from the professional also, must just try to explore and do some research. Is he really expert in the voice disorder or in the small kids or some other communication disorder? So this is the message. And if the voice therapy doesn't work for one particular patient, so don't get disappointed, because if you have not taken treatment from an expert, immediately don't go take the conclusion like, okay, voice therapy is not helping, I have consulted XYZ speech pathologist, I need to go now thyroplasty. When you are going for thyroplasty, after the thyroplasty also you need to take the voice therapy, and make sure that the surgeon who is going to do the thyroplasty, he should have the speech pathologist, voice therapist in his center. What I'm seeing nowadays, people do the thyroplasty and they will ask the patient, okay, you can, I have done my job, now the next job is the speech pathologist, now you can go and take the voice therapy. So my question is, if you have the operation theater, if you have the nurse, if you have the bed, if you have the anesthesiologist, if you have the surgeon, then why not you are having the voice therapist at your hospital, so that you can provide holistic treatment to the patient. It's not like after doing the surgery, you are just sending the patient, okay, I have done my job, take the voice therapy from anywhere. So this is my question and my suggestion for the people. So I was talking about the like high pitch voice signs, symptoms, cause, and the treatment. So in treatment, we are not going to replace the vocal cord. What vocal cords you are having will help you to vibrate in a more effective manner, so that you will be having the best voice. So that's why if you explore our YouTube channel's video before and after treatment videos, you will be able to see the different patient got different changes. So why it happens? Like the frequency, if any string vibrates, the frequency will be depending on the mass of the vibrating string, length of the vibrating string, and tension of the vibrating string. So different people will be having different mass and the length of the vocal cord. Of course, they are not vibrating in effective manner. I'll be helping them to vibrate. So they will not be having exactly the same mass and the length. So I'll stimulate whole mass and the whole length. So the post-treatment voice will be different for different patient. In a more simpler manner, if I will just take my index finger, for example, and I will measure with the 10 people surrounding to me, it will be not be exactly the same length. The same way, the vocal cord will be also not will be having exactly the same length. So that's why the or same mass it will not be having. So after the result therapy result, the different patient get different result. Of course, they will be having better result, but they will be not be exactly the same. Okay. So I'll just check any question if I'm getting. I'll try to give the answer. And there are a few people who has joined. Thank you all for joining us and watching us. Very common question will be how to contact you. I'll be getting in my YouTube channel comment box. Like contacting to me is very easier. You can refer the description of this video and you'll find the contact details. So we'll stop this live. And Peter, thank you for joining us and thank you for taking services from our center. Anyway, today is the first day, and of course, in the future, we'll be doing post-treatment live as well. Thank you so much, and we'll stop this live. But before that, once you tell us again, what is the exactly problem you are facing and where you stay at this moment? Unmute your mic.
I stay in the UK and I have a high-pitched voice, which many people mistake it for a female voice or a child. So I contacted you so that you help me with voice therapy so that I'll be able to have a much masculine voice as expected. Thank you.
Okay, thank you so much, Peter. And now we'll stop this live. Thank you all for joining us. Thank you all for joining us and watching us. We'll stop this live now. And